now we are going to ask Gordon Ferguson, our Rotarian, fellow Rotarian. Hey Thomas, how's it going?
Sorry.
No, it's all right. I'm glad you're here. So we're going to ask Gordon to come up and introduce our speaker, and then when she's done, we'll continue with our club business.
Good afternoon. I'm sure many of us watched the Super Bowl the other evening, and it was really cool to see Juwan Jennings play one of his best games, and it was even cooler when you heard Jim Nantz or the announcer reference that Juwan Jennings was from Murfreesboro. Don't have Juwan Jennings here today, but I do have somebody from Murfreesboro. Brittney Urso is the administrator of our neighborhood hospital in the Westlawn Blackman area. Brittney is a nurse by background and graduated from MTSU and spent some time with our hospital in Nashville at West Hospital, and then came over to our hospital and helped us start up our clinical decision unit, which was an expansion onto our ER that we did several years ago. And then when we were deciding to build a neighborhood hospital, we needed somebody that could understand a lot of the clinical operations of that facility, but also the administrative operations. So Brittney has served us in that role, worked with us during the construction, got the building opened, and then it's hard to believe, but we'll be celebrating our 1-year anniversary there coming up in March, next month. So it's my pleasure to introduce Brittney. Brittney has done several presentations to various civics groups because a lot of people don't really understand what a neighborhood hospital is. So I'm pleased to introduce and recognize Brittney Urso today. Thank you.
Thank you so much, Gordon, and thank you all for the opportunity to be with you today. So hopefully I can answer some questions and provide some good information about a lot of the great work that we've seen over the last year. It's been an honor to be a part of this project. I love new projects and new challenges, and have been back with St. Thomas since 2015. I moved here to go to college at MTSU, and I fell in love with Murfreesboro and made it my home, live here with my husband and have a 6-year-old son. So very much enjoy being a part of our community, especially with our growing side of town in our Westlawn area. So yeah, go ahead. So these are a few pictures of our Westlawn campus if you haven't had a chance to drive by, but we're located right next to our Tennessee Orthopedic Association, as well as our new MMC clinic that just opened right behind us. So lots of services to provide in this location, and then you can see the building is 2 floors, but our emergency department and our inpatient rooms are all on the first floor. Our second floor is shell space currently, with future plans to hopefully have physicians' offices there, but it's not announced yet when we will start the construction of those offices on the second floor. So also a picture there of one of our ED rooms. We have a total of 8 ED rooms and a triage room, as well as 2 of those rooms are very large with extra lights for some of our sicker patients or pediatric patients, cuts and things like that we have extra lights. We call it our trauma or resuscitation rooms. So we have lots of extra space there for anything that can walk in the door for an emergency. So and then also another picture of our nurses station. So I'll talk a little bit more about it, but the whole concept of our neighborhood hospital was built on an open concept so that everybody in the building could be helping with multiple tasks. Go ahead. So opening day, like we said, was March 20th last year. I can't believe we're coming up on our year mark, but super excited about all the great work that's been done this last year and the patients that we've been able to serve. We do have 8 ED treatment rooms, like I said, and we also have 8 inpatient rooms. So this is really unique to a neighborhood hospital. So no matter what emergency walks in the door or what ambulance brings us, we will treat. and take care of you, and hopefully you will be discharged. But if in which case you do have to be admitted for a low length of stay, so maybe a day or two, you just need some fluids, some flu, pneumonia, things like that don't need specialty consultation, we have 8 inpatient rooms. They're all 8 private rooms with their own private bathrooms, and like I said, the entire building, one hallway is our inpatient side and the other hallway is our emergency department side, and so the nurses station and the physician station is open to both sides. So those nurses are very close to you when you're in this setting. They're in and out very frequently, as well as our ED physician that's there 24/7 also. So we also have diagnostic imaging, including CAT scan, X-ray. We have both portable and in-room, and then we also have ultrasound services during some of our peak volume times, 7 days a week, which has been really exciting for us. And we also have diagnostic labs on site. So we do only do labs for our ED patients or our inpatients. So it's not an outpatient lab. We do still have that offered at St. Thomas Rutherford. But we do about 30 different labs on site that can help us to determine any type of emergency that we would need to either admit or discharge based on those labs. So really excited to have that there. So I know this is a really simplistic image, but it kind of gives you an overview of really like I said, the open concept. And so all of our staff are required to have a minimum of 2 years of clinical experience in their specialty, whether that be emergency or inpatient. A lot of our staff have done emergency care or critical care so that we can help each other throughout the building. So we're staffed 24/7 also with a board certified emergency physician, which is also really exciting because they can help us with any type of emergencies that come up with our inpatients. And then we're really focused on efficiency and movement through the facility. So as of now, our what we call the time that you wait to see our ED physician is about an average of 4 minutes. And we've been able to maintain that even as our volume has increased. I can tell you the 2 weeks we were open, last March, we saw about 140 ED patients. And just in December, we closed out with a little over 1,200. So we've grown tremendously and are so glad to be here to be able to serve that community. So I have a video that I'd like to show you. It's our virtual video that will show you a little bit more in depth about our rooms and some of the equipment, and then open it up for some questions. So
To Ascension St. Thomas Rutherford Westlawn in Murfreesboro, Tennessee.
You want to take a question while you wait?
sure.
So the 4 minutes, so when does that clock start? Does that start when you walk in the door, sign a paper, how
As
do you
soon as
read
you walk in the door and you'll be greeted with at our registration desk. As soon as you come in, provide the name. As soon as they get your name into the computer, then our ED physicians and nurses see your name immediately pop up on the board. And we also have our overhead paging system for every time a patient walks in, so that we know that a patient is there, so we can immediately greet you as soon as we can get to the front door, either in our triage room or take you back to an open room.
So the 2 officers, are you happy with that? And how does that rank that competitive? You look at yourself across your hospital?
Overall, we are beating our competition, and we actually, this is the first neighborhood hospital in Tennessee, but it's actually the 40th one across the country that's been opened, and we are doing exceptionally well for door-to-doctor times, and trying to continue to maintain that is what we really want to focus on, so that we're seeing, as soon as you get there, the physician is seeing you.
I just want to say I have a friend who was in the hospital last weekend. She has congestive heart failure. And she said she was kind of, she didn't want to go there, but she was sent there by the little minute.
The urgent clinic? Yes, yes.
And she said she hates going into emergency rooms.
Yeah.
And she said it was 4 minutes that you immediately took care of her that she didn't end up having to spend the night and that she was totally impressed.
Excellent. Thank you so much for sharing that, and that means a lot because we can look at numbers all day long, but hearing it truly from people that have been there, it's unfortunate that she had to be there, but
She was really
Thank you
excited.
so much.
She said she was the only overnight patient.
she got extra special. Yes, I love it. Yes. Excellent.
Welcome to Ascension St. Thomas Rutherford Westlawn in Murfreesboro, Tennessee. We are located in the Westlawn and Blackman communities and provide 24/7 emergency and inpatient care with board-certified ER doctors, making it easier for you and your family to receive care when you need it. During this tour, we will walk through the patient experience with you, showing you the waiting areas, patient rooms, and the many services and amenities we have here to serve you. To access Ascension St. Thomas Rutherford Westlawn, enter the parking lot off of Veterans Parkway or Shores Road. If you are seeking medical care, please enter the building through the emergency entrance. This is where you will register. You and your loved ones will be able to wait in our emergency care waiting area that offers TV and Wi-Fi access. You will then be taken to our emergency care wing, consisting of 8 exam rooms, including 2 treatment rooms and 1 triage room. Our ER is staffed 24/7 with board-certified ER doctors and an emergency-trained nursing team. Outside of your room, you will find our 24/7 staffed nursing station. Designed with the patient in mind, our care teams can easily monitor rooms and quickly respond from the nursing station, so care is always near. If it is determined that you need imaging, we offer on-site diagnostic imaging, including CT, X-ray, and point-of-care ultrasound services. If lab work is needed, our in-house laboratory allows expedited results on standard tests such as strep throat, complete blood count panels, pregnancy, and more. This provides our care team with quick results to deliver the best patient experience possible. For some conditions, your doctor may recommend an overnight stay in the hospital. Our hospital is equipped with 8 private inpatient rooms. During your stay, you will be cared for by a registered nurse and hospitalist doctor via telemedicine. While you're here, food service is available with the ability to accommodate special dietary needs. If you have family and friends who wish to visit you during your stay, we have a designated inpatient waiting area, including a TV, Wi-Fi access, and a coffee bar. If at any point you need more advanced care, we can quickly transfer you to an Ascension St. Thomas hospital. When you choose Ascension St. Thomas Rutherford Westlawn for your care, you are connected to an integrated network of care throughout Middle Tennessee. Our care teams are dedicated to providing compassionate, personalized care to you and all our neighbors in Rutherford County and surrounding areas. Thank you for trusting us with your care.
Thank you for sharing. I think I have one more song. So we talked about our board certified ED physicians that are there 24/7, and you may have heard in the video what we call telemedicine. And so our hospitalists that see our patients on our inpatient side are telemedicine. And so we have, this is actually our telemedicine cart. So it looks a little small in the picture, but it's actually a very large cart. Very large screen with a zoom camera on the top that can actually zoom in to any type of wound, rash, those type things. The telemedicine cart, it also has a stethoscope, and it also has an otoscope and ophthalmoscope. And so even though the physician is on screen, the nurse is in the room with you while the doctor is seeing you on the screen, and they help with those assessments. So they're right there. We have dedicated times that they see our patients every morning, and then also in the afternoons if we potentially see that there needs to be a second visit. And then of course they're available on call all day. So telemedicine's been a big question for us since it's kind of new to some people, but I can tell you that we have had really great results with our telemedicine. The physicians they're right there, and you know, the nurse can sit down with you, talk, answer any questions, and so you have both of your care providers in the room at the same time. So, and then also being able to have our telemedicine as well as our ED and inpatient rooms so close to each other. As soon as we know that you need an admission and you don't need any specialty consults and can stay with us at Westlawn, the inpatient nurse is coming to you in your ED room, meeting you, greeting you, seeing you with the physician, and immediately taking you to your inpatient room to get you settled. So we're really proud of that. And want to continue, like I said, to really focus on efficiency as we continue to grow and get busier, and keep those good, patient satisfaction coming for us. So we're really proud of it. Yes, ma'am.
How does an ambulance determine where they take patients? Do they go to the main St. Thomas or?
Great question. So we do have, with Ascension St. Thomas as a whole, we have an entire EMS outreach department. And so we continue to do education with them. And before we even opened, we set out some criteria. So for example, if we know that if you're having chest pain and they do an EKG and they know that you're potentially having a heart attack, they're going to take you straight to Rutherford instead of to Westlawn, because we know that you're going to need a cardiologist. Same thing with stroke-like symptoms. If at any time they call in, if the ambulance calls in to let us know that you're on the way and the ED physician is questionable about if you might need an intervention, they can always say, take them straight to Rutherford. We average about 15 ambulances a month. A lot of falls, lacerations, broken bones, abdominal pains, nausea, vomiting, those type of things that don't need immediate surgical intervention. So good question.
I guess what I'm trying to learn is, say, I'm with someone that needs to come to the hospital.
Sure.
And I think I can get there quicker than an ambulance. And depending on, I guess, what would the level of care need to be?
I would say,
for me to determine.
Yeah, absolutely. It's a great question. And it's a challenge for us, especially as a community. And we kind of say we can't always. We want you to go to your closest ER, obviously, especially for emergencies, because no matter what walks in the door, we're capable of taking care of that. And then if you need to be transported to Rutherford, we have ambulance services that will take you immediately over. So rather than trying to say and diagnose to know what's happening, to which direction to go, that's why we're fully functioning in the ED. We see a lot of pediatric patients. We've had several stroke patients, and we actually have beaten some of our record times to get them in the door and transferred to Rutherford for treatment very, very quickly. So does that help a little bit?
Yeah, I think so. I mean, to go to our main hospital's emergency room sometimes is less than desirable. I mean, I have to be honest and transparent. I mean, whenever you get there, it's like a walk-in clinic.
Yeah, it's very busy.
Wait.
And that's why, we know that we needed to open Westlawn, because we want to be able to serve our community and have emergency care quicker. And so that's why we say go to your closest one, and we will get you the treatment that you need. Yeah. Yes. Oh, sorry.
Okay, I'm trying to. I'm sorry. So, are there ER doctors?
Yes. So we have an ED physician there 24/7, always. Yes. That see all of our emergency department patients. The telemedicine is just for our inpatients that have already been seen by ED doctor and are being admitted, and they're managing the inpatient care. If at any time the patient needed to have the physician intervene for any reason, then our ED physician also sees our inpatients. Yeah, great question.
So you mentioned pediatric patients.
Yes.
What can you and can't you do for kids at that location?
So we do not admit pediatric patients to this location because they need a specialty pediatric physician. But as far as our emergency department, we can see any age and any complaint. We've actually about 20% of our volume has been pediatrics. If you think about that side of town, younger families, lots of schools around. We've seen lots of broken bones, like I said, lots of lacerations, a lot of RSV, flus. Things like that. And then if for some reason the patient did need to be admitted and needed specialty care, we could transfer to Vanderbilt or Centennial, one of our local pediatric specialty areas. Great question.
So that's a good real estate spot. Are there thoughts for like expansion, either up, sideways?
So for this particular building, for us to maintain our efficiency and the times and the specialties that we're really trying to focus on, the plan is not for us to expand our inpatient beds and ED beds. And that's kind of been proven across these other neighborhood hospitals. So sorry. Go ahead. Yes.
So, to kind of expand on the previous question.
Yeah.
If I was, let's just say a stroke victim, but I went to your facility, because it's the closest one, and you processed me and sent me to the main hospital, what happens then? Do I have to wait in the emergency room for
No.
what, because you've already processed me, right?
Correct.
So I go right into cardiac care if I had gone through your emergency room?
Correct.
Versus,
That's a great question. Yes. So if you come to us, we're a department of Rutherford, and so whatever diagnosis we say, let's say that unfortunately you are having a stroke and you need to go to the ICU. We call the ICU doctor at Rutherford. The doctor gives a report. We get an ambulance and we take you straight over to the ICU bed. You don't start your process back over in the emergency department. Yeah.
okay, good, thank you.
Yeah.
I was having dealt with somebody who had a stroke.
Mhm.
Minutes are precious.
Yes.
So if you take them to your hospital,
Mhm.
give them medicine to try to
Yes.
slow the stroke so
Yes.
that they go.
Yes, ma'am. Great question. We do. We have our CT on site. We have a 64 slice CT, and we can also do perfusion scans, which is exactly what we need for all of our stroke patients. And then we have the TNK or TPA is the medication that we use, and we can give that immediately for any stroke patient. Yep. Yes.
One simple question, what's the D stand for?
D.
Canadian.
Emergency department. I'm so sorry. Yes, thank you. Old school ERs. Yes, ER. I'm trying to use the right language.
Second question, which maybe Gordon may want to answer. Are you planning more facilities like that around Rutherford County?
Not currently. I think we wanted to see how this would work first. As Brittney said, this was the first of its kind in the state. And while there are other cities in the country that have multiple, we wanted to see how this one does first. I think that probably with our demographics, it might make some sense, but it costs about $26 million to build, and we just want to make sure we get this one
Right.
up and
Yes.
running.
Does this go through the same permitting process and regulations that a fully functioning hospital will?
Yeah.
Okay.
Yeah, joint commission, came out of state, came out of
Yes.
My son is a radiologist, a premier radiology. Do y'all have them do any of your readings for you?
We do. Yes. Yep.
to do all the.
Yes. Yep. With since we're a department of Rutherford, we're all under the same umbrella with Premier.
I get offers on the internet all the time wanting me to come to North Carolina and read their x-rays.
Well.
for them. And I asked my son if he thought I should do that. I said, yeah, sure, you can tell them what you think.
There you go.
They probably ought to get a radiologist. It's the same name.
Sure. Yes.
The girl that took my x-ray for a hip x-ray said, oh, I did a clinical rotation under your son up at Mount Juliet in a training. Where
Nice.
She recognized the name, but I asked my son and he didn't recognize her. He said they run too many students there.
We do. Yes. Yes. Yes.
I find it very interesting, we're open neighborhood, I'm like John, I won't call it ER, but EDs and beds, because 5 to 10 years ago, they're closing all small community hospitals. Because they were found, I guess, not cost efficient or whatever. But I find it interesting that we're going, kind of reversing that trend here. What's your average daily census in the inpatient?
And the inpatient right now, it's 2 to 3. Especially since we're still kind of in that first year mark, we're doing a lot of things to make sure that we're keeping the right patients. And we do a review of all of our patient diagnoses monthly with our physicians, our ED physicians, as well as our internist or hospitalist, to make sure that if there's opportunity for us to keep a patient there versus not have a consult, then we review that so that we can continue to make sure that we're placing the patient in the right place. I mean, that's really the name of the game with all healthcare right now, right? Urgent care, ER, inpatient, consult, those type things. So great question.
Well, I know my great aunt was in Trenton, Tennessee, and she was up in arms because they closed the local hospital, which meant she had to go. Well, I don't know that there's any small ones in West Tennessee left. Jackson's only doing one. I don't know of any small. Is this a trend that you're going to see for these small communities? And we have a hospital. Granted, we're big, but some of these communities have nothing.
Yeah, and we've got several of our hospitals out in these smaller areas, Smithville and River Park down at McMinnville. This hospital does not have any operating room suites, and we do not deliver babies. So if you got somebody in labor, we do not need to come to Westlawn. But I think that's what makes this a little more efficient. Just the layout, just everything's just kind of right there, and then we don't have the overhead that you've got with these other services.
Yes.
Go ahead.
Go ahead.
Okay, if you get, have an ambulance deliver you to Westlawn, and you go through the emergency department, then they say you need to go to St. Thomas, do they get charged another ambulance bill between the two?
No, great question. Because we're a department of, and you're not, we typically use our St. Thomas EMS system, which is part of Ascension and St. Thomas, to transport over back and forth. So no. Great question. Yes.
So, EMTs are transporting somebody,
Yes.
do they have some kind of communication that says, oh, this place over here is booked right now, we need to take you to the other one because you'll see somebody quicker? Do they work that way?
Not necessarily. It's more about patient complaints and appropriateness of place or patient requests. So if you were in the ambulance and you requested to go to Westlawn, if you were having a heart attack, they might suggest we really want to take you to Rutherford because we think you're going to need cardiology. But it's not necessarily about wait time or capacity. It's more about patient diagnoses or complaint. Yeah.
I experienced that with my daughter. It was not related to Ascension, so I won't name names,
That's
but it
okay.
was not Ascension affiliated. But the closest location was a place that might be able to help a child. But the EMT didn't say, I don't think you should go there. Because I said, well, such and such is closest, and he said, she's not, like, this is an emergency, but she's, like, stable, everything's fine. You might want to think about other places to go. And I said, so you're saying Vanderbilt is further, but we should go there? And he said, I'm just saying we'll go wherever you want. So I took it as they're not going to tell you where to go, but
Yeah. We really try not to. We want,
yeah.
you're the patient, you have right. So, yeah. Yes, sir.
Probably another Gordon question. It would seem to me with the increasing population in Rutherford County and with the increasing elderly population, of which I count myself, are you, because I've seen in other places, are you tied into some of the nursing homes, relationships with them? And is this something, I would think this might be a natural add-in to that relationship.
Yeah, we're not tied in the sense of having any ownership in nursing homes, but certainly our case managers, social workers have got relationships and we work very closely with them. On this one, again, our inpatient census is very low and the acuity is very low. But however we can work with local organizations to help that continuum of care, we certainly want to do that.
That leads into my question, thank you. So I have my stroke, get to Rutherford, go in through your facility, get to Rutherford, you do whatever you do to fix the problem, say I need surgery. And I do the recovery at your place, but I need continuing care. Where do I go in Murfreesboro to get that continuing care until I'm ready to live back on my own? I'm fairly new to the area, so I really don't know.
Sure, great question. So, in that situation, if you just need like a rehabilitation
rehab
facility, yes, absolutely. There's, I don't know all of them off the top of my head, but we
there
do
are
have several
several.
opportunities. Yes, yes. So we're
NHC,
yes.
and also Trust Point.
Okay,
Trust me.
thank you.
Yeah. Yes, sir.
I didn't see a helicopter pad on the aerial view. If somebody needed to be flown out somewhere to be transferred, do you have a provision for that?
We do. Great question. So if somebody walks in and we know that that's happening, we're immediately calling for our helicopter transport, just like we would at Rutherford. And then EMS is going to go to Rutherford. I know it sounds like it's farther than it is for a helicopter ride, or for EMS and then to get the helicopter, but with lights and sirens, it takes about 6 minutes. And by the time the helicopter gets up and lands at Rutherford, we're going to meet there. So. Yes.
I worked in food service in a hospital for years and
Yes.
years and years, and I'm trying to think.
I was waiting for the food question.
How
Yes.
could I justify feeding 2 or 3 patients and the staff? So what do you do for meals?
Great question. So, you know how we kind of talked about the open concept, and a lot of our staff are cross-trained. So we have, so myself and our food services manager director manage the quality of our kitchen area, but our actual patient care techs and our nurses do the actual food preparation. So a lot of our food prep, like we have, so for breakfast, for example, we have breakfast sandwiches, we have fruit trays, we have oatmeal, cereal, things like that. And we do have some hot meals that we can cook in our convection oven or in the microwave. Same thing for lunches. We have fresh sandwiches, salads, soups, more lunch type things, and then dinner is entrees, like more frozen entrees. And so the nurses and techs are all trained in that kitchen area for compliance and quality to help serve our patients.
So you're basically doing cold food prep or reheating?
Yes. Mm-hmm. Yeah. Mm-hmm. Yes, ma'am.
Ms. Long, I didn't hear you say you had an MRI machine.
That's correct. We do not have MRI. MRI is very specialty now because our CT machines have become so adequate in emergency care. So we have had a few situations, I would say one every other month, where we have transferred to Rutherford specifically for emergent MRI.
But there's one right next to you at Premier Radiology.
At MMC?
Yeah.
Yes, so they do have that at MMC, but it's an outpatient service. And so if it was something that you needed to be discharged and just needed a planned MRI, then we could schedule that with them, just referral based. But if it's, I would say 99% of the time MRIs we use for either like neck spine injuries or stroke-like symptoms. And so we would transfer you immediately to Rutherford if we felt like that there was something further that we needed to see that wasn't able to be seen on CT. Great question.
This might be for another meeting, but just a question about ER at Rutherford and our volumes. You know, we've got a significant issue with the lack of primary care physicians. I see Dr. Wallenhorn here. We've had several retire of late. So unfortunately, a lot of folks in our community are using ER for their primary care, which if you're a low acuity and we've got high acuity ER, they are going to get seen quicker. And we've seen our ER volumes come back now to almost pre-COVID levels. So, but we're working on it. We've made improvements in our role with the provider time. So it may not take you long to see a provider, but if you're low acuity, then you have to probably wait to go back in.
Yeah, that's the frustrating
It is a
part,
big
is
issue.
it's treated like a walk-in clinic
Yeah.
sometimes.
Yeah.
So yeah, it makes that experience not so great for the ones that need
Actually need
care.
the ED.
Yes, yes. Like my 92-year-old mother, it was like 4 hours before the doctor saw her. And yeah,
Less work. Always. Yeah. Thank you all so much for having me and the questions. It was great dialogue.
So let me just ask Gordon one more thing while I've got the chair. So you mentioned that, maybe another presentation, but you can answer this probably quickly. A few years ago, I know you started a program for residents. Your goal was that if we trained them here, they might stay here. How is that? And I know you said you've got a shortage, but is that growing? Is it working? Is it?
Working well. We have 8 residents in primary care, family medicine that get through the program each year after 3 years. It's actually going to increase to 9 next year. And we've not been able to retain all of them. We didn't think we'd retain all of them, but some have gone to work with MMC, some have gone to work with our physician group. So it has helped. And,
Okay.
It'd be great to maybe get on update on that.
That'd be great. I mean, I think that'd be something that would be interesting here.
Or it's a plus, even if they went, I mean, if they went to NMC, at least they stayed in Murfreesboro. Oh, yeah. Because city people cannot get any primary care provider. It's not that they're not looking.
Well, thank you, Brittney, again.